Good afternoon. My name is Dr. E.O. Bonsukan, and our topic today is about high blood pressure or hypertension, since this is one of the common ailments that people around the world has, especially among the older group of patients. The normal blood pressure is said to be 120/80. High blood pressure is elevated, BP. High blood pressure is common worldwide, but is more prevalent among the black population. And to a certain extent, it's also quite common here in the Philippines among Filipinos. The causes of hypertension are numerous. A person's blood pressure usually goes up with exercise. So any physical exertion causes a physiologic response in the rise in the person's blood pressure and person's heart rate. This is what we call physiologic response. When this happens, the patient's blood pressure is high, but then goes right back down to normal when the patient goes at rest. Genetic factors plays a very important role in the development of high blood pressure. In most cases, you can trace it on both parents or in one of the parents, all the way down to the aunts and uncle. So genetic predisposition is definitely present on people to develop high blood pressure. Stress, fear can elevate both the blood pressure and the heart rate. But this response usually goes right back to normal when the patient's stress or anger is resolved. There are people in which the blood pressure is permanently elevated. These are people that are usually overweight and obese and has a family history of hypertension. As far as stress is concerned, this should be managed immediately by the individual himself. How to do this? I would advise the public to look it up in your cell phone under the topic of JAS, General Adaptation Syndrome, otherwise known as the General Adaptation Syndrome of Selye. This will give you a lot of information how stress can raise your blood pressure and what you can do about it. Hans Selye, a scientist from Vienna, was the first one to describe the General Adaptation Syndrome. The mechanism runs this way. The presence of stress stimulates the hypothalamus hypothalamus to release glucocorticoids, adrenaline, and cortisol. The effect is an increase in blood pressure, increase in the heart rate and pulse. These are the sympathetic response of the autonomic nervous system. I think that with this knowledge about hypertension, one can learn how to deal with stress in order to minimize the chance of blood pressure going up. A persistently high blood pressure is not desirable because it can lead to all kinds of health-related problems such as cardiac disease, stroke, and so on. Therefore, if a person listening to this short topic on hypertension, it's not enough to listen and gain information about it. I would encourage you to act, consult your doctor, monitor your blood pressure, and making sure that your blood pressure is controlled to as close as normal as possible. There are ways to control it. The simplest way is weight control and diet. Avoiding obesity and being overweight, avoiding fats and sodium or salt. High blood pressure can become a normal blood pressure, thus obviating the necessity of medication. Those that don't improve with diet and exercise will usually require antihypertensive medication in order to control the blood pressure to normal tensive level. Keep in mind that once antihypertensive drugs is prescribed by your physician, you will be spending money for the rest of your life buying this medication. So it's expensive. Those patients with an uncontrolled high blood pressure, especially those patients with so-called malignant hypertension, they are usually related to kidney disease, will have problems with their blood pressure and its complication if they remain out of control. So guys, go see your primary care physician, have your blood pressure checked and rechecked, and get some advice and possibly medications in order to ensure that your BP stays within normal range. Thank you.